Welcome, welcome, welcome. Thanks for joining us on this live. I can see Andrew Igbineweka, my dearest husband. Thanks for joining us. So, welcome, guys. Welcome for as many persons that are live with us. Welcome. Thanks for joining us on our first episode of the Ask a Doctor series on Jemi Baby Care. Yeah. So, I've been sharing my story basically a couple of weeks ago now on how that I observed so many things in the journey of childbirth, right? And I was privileged in the experiences I had. And part of the privileges I had was the fact that I had access to doctors, like I had them. And so whenever something would come up in the course of the week, even when I was not at work, I could easily call my doctor on the phone and say, "Oh, this is something that's happening. This is something I've observed. So what do I do?" And they always tell me, "Oh, do this, do that." And then even when I had Google to guide me, and which could also be misleading at some point, I remember I would check with the doctors and they'll be like, "Oh, don't do that. That is not the diagnosis for that condition and all." And so looking at the experience critically and observing the experiences of others as well, I really wanted to be able to give that an opportunity where you can have to talk to the doctors and ask your questions. And I know it may not be possible within the clinic settings because it's an official time where doctors have to work. And so we're bringing you the doctors on screen live on Jemi Baby Care. And for our first interview, we're going to be having with us the amazing Dr. Olufemi Idowu. Is a medical doctor, an author, and a mom of two, and also a passionate advocate for women's health, women's sexual health, and fertility. Now, she brings a unique approach to health education by seamlessly weaving medical insights into captivating novels, thus empowering readers to understand their health while enjoying these captivating stories. She uses her social media platforms to inspire and educate her audiences worldwide. And tonight, she's going to be sharing with us on the topic fertility tips for both men and women. That's for couples preparing for a baby. Now, please welcome, join me as we welcome Dr. Olufemi Idowu to take the stage. Thank you.
Hi, Dr. Sophia. Thank you for having me on this platform. It's an honor to be here, and I'm actually excited about the topic that you choose to talk about because it's a topic that is very dear to me, right? And I
Yeah.
can totally relate to your experience because I've had many patients that have been in similar shoes as you, right? First time mom,
Mhm.
that didn't know what to do, and even women that got married and for whatever reason were not able to conceive. I didn't really know what steps to take or what the problem was. So hopefully today we're going to be breaking all that down. So do I have the floor?
Okay.
So welcome to everyone. Thanks for joining this live. It's a pleasure to be here with you. Um when we talk about the topic of fertility, right? I'm glad that Dr. Sophia has included men in this discussion because what we usually find is that men exclude themselves from this discussion because they feel like they are not part of fertility. When a couple is unable to conceive, automatically every hand is pointing at the woman, and people forget that men are also involved in this. In fact, a good percentage of infertility cases are caused by male infertility. So this is a discussion that both men and women should be having, right? So before I talk to the men, I'm going to start with the women because women are the ones that bear the brunt of any infertility issues. Society is always blaming them for inability to conceive during marriage. So let's start with the women. Um, it's common knowledge that as you age, as you grow older, once you cross that line of 30 years, in fact from your late 20s, your fertility starts to decline as a woman. But this is not to say that you cannot have children even in your 40s. No, it's just that your chances of having children starts to decrease, but it doesn't mean you cannot have children. But it's important that you are aware of these facts, right? So you can make informed decisions. For example, choose to start having your kids early if it's within your control. For example, if you're already married, rather than delay having kids, you want to start having your kids earlier because that is when you are the most fertile, right? So, when you want to have a baby, first thing I'll like to advise all couples trying to conceive is, if you've been trying to have a baby and it's not happening, don't put pressure on yourself. Because the worst thing you can do is put pressure on yourself. Babies don't like stress, they don't like wahala. So if you are stressed, they will not come, right? That's not medically proven, but it's a fact. Anyway, um, don't put pressure on yourself. Don't take baby making or bedroom activities as a chore. Enjoy every moment of it, enjoy every minute of it, and enjoy every minute of you not having kids. Because as much as we all want to have kids, we all want to be fertile. When kids come, your life will change drastically, right? You may not have time to do some of the things that you could do when you were without kids, right? As a couple, you may not have time because now there's a baby in the picture and you have to consider the baby first before any other thing, right? So enjoy every phase of life, right? And don't put pressure on yourself. It will happen. It's only a matter of time. And that's what I like to tell all my TTC moms, right? So, as a woman trying to conceive, what are some of the things that you should be aware of? There are a number of things that you should know, but I'm going to start with the very basics, and that is your menstrual cycle. When trying to conceive, you should be very familiar with your menstrual cycle. You should know how many days your menstrual cycle lasts, how long your period lasts, if it's heavy, if it's light, if you have any associated symptoms with your period. You should start to observe those things, right? And I have videos on my platform where I teach people how to calculate their menstrual cycle, right? So they know when they are ovulating, right? And if you don't want to go through the stress of having to do that manually, there are many apps on your smartphone, either Google Store or Apple Store, where you can download. They are like period tracker apps. They help to track your period. They will calculate the length of your cycle for you, and they will calculate when you are ovulating and all that. And they help you to be able to record your symptoms, right? So this makes it easy for you. All you have to do is put the start date of your period, put the end date of your period, and the app will do the rest. So you can check that out, right? If you don't want to go through the stress of doing that manually. Now, being familiar with your menstrual cycle, why is this important? Because for you to be able to conceive, you need to be targeting having intercourse during what is known as your fertile window. So some people might be asking, okay, what is fertile window, right? It's very simple. Your fertile window, right, is the period few days before your ovulation. That is about 5 days before your ovulation and 24 hours after, right? So this is a period of about, say, 5 days plus 1 day, but so a period of about 7 days, right? Now, some people might be confused. Okay, I've got another big grammar. I'm still grasping, struggling with fertile window, and then you're coming and talking about ovulation. So I'm going to break it down for you. What is ovulation? So ovulation is that period in your menstrual cycle when an egg or eggs are released from your ovary or your ovaries, right? And your ovary is the part of your body where your female sex cells are stored, right? And this female sex cell is what is eventually going to unite with the male sex cell to form an embryo, which is the beginning of the developing stage of a baby, right? So you need to be able to know when that egg is going to be released, because for pregnancy to happen, egg from the woman must meet with sperm from the man to make a baby. So if you don't know when that egg is coming, you might be trying to get pregnant, but unknown to you, you are trying at the wrong time. It's just like you trying to catch a bus, right? And you go to the bus stop. But every time you get to the bus stop, the bus has already left. Or you come too early and you're like, this bus has not come. You will now leave. After you have left, that's when the bus will now come. So you need to know the time your bus is arriving to know when to catch the bus. So that's what tracking your menstrual cycle does for you. It helps you to know the time the egg, which is the bus, will arrive so that you can catch it, right? So it's important, like I said, for you to be able to study your menstrual cycle to track your ovulation, right? Now, apart from tracking it using like the calendar method, right? That is tracking it using all those apps and everything. There are other ways you can know that you are ovulating, right? Because let's face it, the calendar method or using those apps really only works for people that have a regular menstrual cycle. That is people that their menstrual cycle comes regularly, right, and within around the same time frame. So when I say regular, I don't mean your menstrual cycle has come the same day every month. No, It varies, but the difference will not be more than 7 days difference. If the difference in your cycle is more than 7 days, then your cycle is not regular, right? So for people that don't have regular periods, this is not to say they can't conceive or they can't track their ovulation. There are other options that they can use to track their ovulation, right? One of those options is the easiest is to just use an ovulation predictor kit, right? And you can get it from any pharmacy. It's readily available in most pharmacies. Everywhere in the world, including Nigeria. And I have one here with me that I got from the pharmacy here just to explain to you what it looks like and how it works, right? So it usually comes in packs like this, and there are usually a number of them because when you're tracking your ovulation during your cycle, you are going to use it during a number of days, right? So it will come in a pack like this. And I have one that is already open. I can't find it. So I have to open another one. It pretty much looks like a pregnancy test kit, right? So most pregnancy test kits, this is what they look like, right? And they have an indicator window that tells you whether your pregnancy test is positive or negative. In the same way, the ovulation predictor kit has an indicator window that tells you whether your ovulation test is positive or negative. Just like a pregnancy test kit, one line is negative, which means you are not ovulating, and two lines is positive, which means you are ovulating, right? So when you see two lines on this, because what this thing does is it measures a hormone in the body called luteinizing hormone. So when you see two lines on this, doesn't necessarily mean that you are ovulating at that moment you saw the two lines, but it means that either you're going to be ovulating in the next few days or you're ovulating at that moment, right? So when you are continuously testing for this, I mean, testing with this, two lines will tell you, okay, this is the time for me to intensify my efforts in the other room. Like, so that's the easiest way. But if you say, oh, I don't want to go through the stress of getting an if you don't want to go through the stress of getting an ovulation predictor kit, right? Then you can decide that, okay, I'm going to check, I'm going to use other methods. Now, another method you can use if you want to track your ovulation, apart from, because I've talked about the calendar, use the apps or check my videos and see how to calculate it manually on a calendar, right? And I've talked about ovulation predictor kit. Another method that is very common is the cervical mucus method. So what do I mean by cervical mucus method? You know, as a woman, um, every time that you go through changes in your cycle, you might notice some discharge coming out of your private part, right? Now, this discharge is usually different during your ovulation period. Before you start ovulating, if you see any discharge, it's usually like sticky and thick, right? But the one that comes during your ovulation, it's more whitish or even transparent or clear, and it's thin and stretchy. You know, like how when you break an egg into a bowl, that's transparent or white part of the egg. You know how it feels very sticky and slimy and stretchy. That's similar to the consistency of how your ovulation, your cervical mucus will feel like during your ovulation. Now, some women might not like this because, like, why am I playing with my discharge and all that? Of course, wash your hands before and after. But then, if you are really trying to conceive, it can be an extra step to give you a clue to the fact that you're ovulating. But then again, with this method, some women will say, oh, I don't really notice it. I never really seen it, blah, blah, blah. The truth is that sometimes it requires a level of expertise. You must have been studying this discharge for a while to really know the difference, right? If you're not an expert, you might have to get some practice. So it might not be the most practical way for women, but if you want an added step, you can, try that. Another recommended one is your basal body temperature, where you use a thermometer. And I don't recommend those infrared ones. I'll just be measuring your forehead. Those things are never accurate. Use a proper probe thermometer or mercury thermometer and measure your temperature daily. So during your ovulation, there will be a slight increase. And when we say slight, it's like zero point 0.2, zero point 0.3, nothing major, not like you will have a fever or something. So there'll be a slight increase in your temperature, and that's the indicator that you're ovulating. So to do this again, you must have been measuring your temperature daily so that you will now notice when there's a slight increase. To be honest, this can be very tasking. Like some people will like I don't have work, or have I now become a nurse that I'm now measuring temperature every day and all that. So this might not be the most practical step for some women. So that's why what I usually recommend, if you have an irregular period, just use an ovulation predictor kit. Another thing is there are some special women that also have certain symptoms during their ovulation that helps them to know that, oh, the egg is passing, the bus that we're waiting for, right, is coming. So, and that's one particular symptom that women experience during their ovulation that is very obvious and is a telltale sign. It's something called middle pain, also known as ovulation pain. So, for some women, you will notice that at the time of your cycle where you're ovulating, you feel some pain either in the right or the left part of your lower abdomen. That's where the ovaries are situated, right? So, normally, the pain normally comes from the part of the ovary where the egg is being released from, right? And when that happens, just know that you're ovulating, especially when it happens around the time of the month you're expected to ovulate. And this pain usually does is not permanent. It only lasts for few hours to maximum of 48 hours. But for most women, few hours to 24 hours, the pain is gone. So if you're feeling that pain, honestly, that might not be the time you want to be having intercourse with your partner, but that is the time you should. So deal with the pain using pain relievers and then get to work with your partner because that's the time that you have highest chances of getting pregnant, right? Now, we've talked about how you can track your ovulation so you know when the bus is passing, right? That is the basics of getting pregnant, right? So if you are constantly studying your menstrual cycle, tracking your ovulation, and having frequent intercourse during that time that the egg is going to come, which is your fertile window, then chances are you are going to get pregnant. Now, how often should you be having intercourse? During that fertile window, preferably have intercourse every day during that window, right? And if you're not sure of, because your cycle is irregular, you're not really sure of how to, you know, track your ovulation or your fertile window, you can have intercourse at least every 2 days, right? Every 2 days where possible. And so some women will say, okay, I've been doing this, I've been having intercourse in my fertile window, I track my ovulation and all that, but I'm still not getting pregnant. That is where infertility comes in. Before I say that's where infertility comes in, we have a definition where we as doctors define if or we say that truly you are dealing with infertility, right? And that period is, like I said, because your fertility declines with age. So we have an age mark that we use to define this. So if you are a woman 35 years and above, and you have been trying to get pregnant, that is having regular intercourse during your fertile window for at least 6 months, right? And it's not happening. After 6 months, please see your doctor because we want to investigate and see what the problem could be, right? However, if you're a woman 35 and below 35 years, we, and you have not gotten pregnant by the 6 month mark, for us, you are not infertile because you are still young, right? When we say you are infertile, is if you have been trying after 1 year when you are below 35 years of age. If you've been trying having frequent regular intercourse during your fertile window for 1 year and nothing is happening, then as someone below 35 years old, please see your doctor, right? Now, like I said, if you have been trying and we say, okay, nothing is happening, we can now say, okay, maybe we're dealing with a case of infertility. So now we're not thinking, what could be the causes of this infertility? Like I told you, there is male factors, there's female factors, but I'm talking to the women right now. So for women, some of the reasons you may be experiencing infertility, especially if you have crossed out the first one, that is timing of intercourse. You know you are having intercourse at the right time, so it's not about the timing. One of the reasons may be if you have issues with ovulation, right? Especially people that don't have regular periods, they might be dealing with issues ovulating. Because if you're not having regular periods, doesn't mean you're not ovulating, but it's difficult to track your ovulation. One, two, it may mean you're not ovulating, right? So if your period is not regular, you could be dealing with ovulation issues. And you know, if you are not ovulating, you can't get pregnant because that means there's no boss. So there's nothing to catch, right? So you need to see a doctor, right? To diagnose the problem and then appropriate treatment will be administered. Another reason might be if your tubes are blocked. Remember that if the bus is passing and there is a roadblock, the bus cannot get to its destination where it's supposed to meet the sperm. So you cannot get pregnant. You can never catch a bus that doesn't reach its destination. So if your tubes are blocked, your tube is the road or the passage that the egg goes through to meet the sperm. So if something blocks the tube, The egg, which is the boss, will never reach the sperm, which is its destination, and pregnancy cannot happen. So there are tests that we can do to diagnose and check whether your tubes are blocked. So your doctor would do the necessary test, and if your tubes are blocked, there are also things we can do to help to remove the blockage, right? And someone might be wondering, how would my tube just get blocked like that? What can possibly block the tube? Is it something I'm eating or whatever? One major cause is something called pelvic inflammatory disease, right? So you can have an infection that goes up to your genital tract. It could be a sexually transmitted infection, be a genital infection, right? If it goes up to your genital tract, when it is untreated, if it's not untreated, I mean, if it's left untreated for a while and it goes up to your genital tract, it could cause blockage in your fallopian tube. So, if during your, I mean, maybe before you get married or while you're married, you notice you have a sexually transmitted infection, please get it treated because it could affect your fertility in future. And this goes both ways for men, but I'll talk about the men one shortly, right? So, like I said, blocked tubes could be the problem. Could be that you're not ovulating. It could be that you have a problem with your womb where the baby is supposed to stay. Because guess what? If the boss, if the boss gets to the destination and the sperm and it meets with the sperm, that is the egg meets with the sperm, what's supposed to happen after the embryo is formed is something called implantation, where the baby will stay in the womb. It will fix itself inside the womb and grow till it's time for it to give birth to the baby. So if the womb that is supposed to grow in is not favorable and does not allow the baby to stick there, the baby will just get washed out as your regular period. Implantation will never happen. So if there's a problem with your uterus, as your womb, implantation cannot happen, right? So we need to make sure that everything is fine. Now, some popular, common problems that women may have with their uterus are things like fibroids or endometriosis, right? So you want to make sure that that's not the case, right? So generally, what we're trying to say is if you're trying to get pregnant for 1 year, if you're below 35 years old as a woman, or for 6 months, if you're below 35 years as a woman, you should see a doctor because we might be dealing with something more than lack improper timing of intercourse. It might be certain issues with your body, right? Now, this is not to say that every time a woman is not getting pregnant, there's something wrong with her. We have something called unexplained infertility, where you're having intercourse at the right time. We have done all the tests and there's nothing wrong with you, right? So in that case, it's unexplained infertility. Even we cannot explain the reason why. We just encourage watchful waiting, right? Or we propose other options, right? It could be IVF if you're ovulating properly, or we can get some eggs, right? It could be IVF, or if for whatever reason you are not able to carry the pregnancy, maybe truly you have a problem, there are other options like surrogacy or adoption. I don't know if we'll have time to discuss that today, but if we do, then I'll get it. So finally, let me move to the men. You know, I said it's not only women that in the equation of getting pregnant, the man has an equal role to play, just like the woman. So it's not a woman only affair. So I hope we have enough men on this live because men too, you need to learn about your fertility. So some of the reasons why you as a man may not be able to get your female partner pregnant may be issues with your sperm or issues with, so basically sperm is the male sex cell, right? And that is what a man contributes to the pregnancy equation to be able to get his partner pregnant. So if there's any problem with the sperm itself or transportation of the sperm, a man cannot get a woman pregnant. So different things that we're talking about. One, production of the sperm. Sperm is produced in the testicles, those two balls that a man has in his scrotum. That's where sperm is produced. And unlike women that are born with a certain number of eggs, that starts to decline over time, which is called their ovarian reserve, right? So when we say that your fertility decreases, because your ovarian reserve, so for example, let's just say hypothetically, a woman is born with 10 eggs. As a baby like that, you're coming with 10 eggs. So every menstrual cycle, you're losing eggs. And even outside of your menstrual cycle, the eggs are just dying off on their own as you're growing older, right? So that's what we call decreased ovarian reserve. That's why, like I said, where possible, have your kids earlier because your ovarian reserve is going down. So your chances are decreasing with age, right? But like I said, this is not to say that if you're 50 years, you can't even have a child, right? As long as you have viable eggs, you can have a child. So unlike women that we come born with a fixed ovarian reserve, men, they produce sperm throughout their lives. Even a 70-year-old man is still producing sperm. But that is not to say because some men will start feeling healthy, so we can get women pregnant every time. No. That is not to say that all the sperm you are producing is viable. You might be producing nonsense sperm. So you too, you should start having kids early, because studies have shown that even men, their fertility starts to decline from when they are 40 years of age, right? So why does their fertility start to decline? Because the quality of sperm will start to reduce. So remember I said that for a man to get a woman pregnant, first of all, sperm has to be good. Transportation of sperm has to be good, right? So production of sperm happens in the testes, right? And it happens throughout a man's life, right? Now, when that sperm is produced, the quality of sperm produced matters. When when you are younger as a man below 40, more often than not, you are producing good quality sperm. So when that sperm gets to the egg, it's going to fertilize it. But when you are getting older, the sperm you are producing, either this count is low, or the sperm, there's something wrong with it. The morphology is off. It's like you're producing, for lack of a better word, disabled sperm. The sperm cannot swim to get its destiny. Before it swims, the thing has gotten tired and died on the way. So, like I said, it's important you start early, right? So, things that affect men: one, production of sperm; two, the quality of sperm, right? Then three, quality of sperm. This also comes under quality, where the quantity, rather, the quantity. So, if a man has low sperm counts, right, he won't be able to, or his chances of impregnating a woman are low. Not like he can still impregnate, but it's very, very low. So chances are he may be the cause of infertility, right, between both partners. If a man cannot produce sperm for whatever reason, maybe he had an accident or heat, heat, because like I said, those two places, those two balls that a man has is where the testis is the one housing the testis, and the testis produces sperm. But for production of sperm, an ideal temperature is needed, right? And that temperature is slightly lower than our normal body temperature. That is why, if you notice, scrotum of men is always it's cold when compared to when you touch their skin and you touch the scrotum. The scrotum is always colder because it houses the testis, and for testis to produce sperm, there's an ideal temperature it needs to produce the sperm, and that ideal temperature is less than normal body temperature. So the testis has to be away from the normal body, inside its own cool sac, to keep the sperm cool. So as a man, if you are exposing that your scrotum to heat, like if you're the one that normally goes inside hot tub and sits down inside hot tub, right, or you wear tight trousers that makes that area to like be hot, you are actually reducing your chances of getting your partner pregnant, because the heat will not allow for proper sperm production, right? And there are studies to back this up, right? So, I talked about quality and quantity of sperm. Now, transportation. The sperm passes through a tube from the testis, right, to get to where it's going to be ejaculated into the woman's private parts. If for any reason there is blockage in that passage, just like in the woman, if there's blockage in her tubes, the sperm can never reach the bus stop, right? And this can also why should a blockage happen? If a blockage can happen as a result of sexually transmitted infection. So as a man, don't think that you are immune. If you have any STI, please treat it, because untreated STIs could actually affect your fertility, right? So I've talked about sperm quality, I've talked about quantity, I've talked about the production. Now, so couples may be asking, what are the things that I might be doing, or the habits that might be affecting my fertility, right? So one of them is smoking, both for men and women. If you're trying to conceive, stop smoking. I didn't say avoid, I said stop, because cigarettes has a negative effect on sperm production, fertility, and even for women, for production of egg. It affects the quality of your sex cells that you're producing, and has so many other detrimental effects. Same goes with alcohol. If you want to conceive, I didn't say reduce, I said stop drinking if you're really serious about conception, right? Because that's also going to affect your fertility. So it's very important that those two habits, you drop it. Then for men, I talked about wearing tight trousers, right? Um and staying in hot tubs and all that. Yes, they affect the production of sperm. So you want to make sure that area, there's no heat in that area. Another habit men do is this hot laptop. The bottom of our laptops are usually hot. You just put it on your lap. You're generating heat to the scrotum, and that would affect sperm being produced. Then another thing that people should be doing if they're trying to conceive is taking folic acid. Why should we take folic acid? Some people think it's only pregnant women that need to take folic acid. No. Folic acid helps to improve the quality of eggs in women and the quality of sperm in men, right? Because if you are producing eggs that are not good, chances are the sperm might not be able to fertilize it. Or if it fertilizes it, because there will be different chromosomal abnormalities, you might get pregnant and have a miscarriage. The body will get rid of that pregnancy because it has identified some abnormalities in the pregnancy. Same as with men, you should be taking folic acid because if you bring bad quality sperm, right, the embryo that will be produced will not be the best embryo. And if there are any chromosomal abnormalities, so chromosomal abnormalities is just abnormalities in the genetic makeup in the genes of that embryo. The body will automatically usually get rid of it in the first trimester as a miscarriage. And chromosomal abnormalities are one of the major causes of miscarriages in the first trimester. So men that are getting married late, 40 years, 50 years, and you're thinking, oh, I'm always producing sperm all the time. The quality of your sperm matters. You might be the reason why your wife is not getting pregnant. That your young fine girl you went to marry. You might be the cause. So men, where possible, marry on time for the sake of your unborn children. Then let me see. Is there anything I did not mention? I've talked about male, I've talked about female, I've talked about unexplained infertility, habits that are affecting your fertility. And I've also talked about things you can do. Take folic acid, eat healthy, right? Always eat balanced diet, fruits, vegetables, they're good for you. Um, and lastly, just pay attention to your health, right? Exercise, sleep well, because stress can also affect your fertility. It can disrupt your hormones, affect ovulation in women and all that, affects even production of testosterone in men. And testosterone is a hormone that is required for, making sperm and your general what okay. Looks like my time is up.
No, no, no. Go ahead, please. Go ahead.
Yeah, so pretty much, yeah, that's what I wanted to say. I've pretty much rounded up on the whole journey, right, of fertility, the basics. So I think it's okay to take any questions that we have at this point.
Okay. Thank you so much, Doc. I've been laughing here since. Fertility for both men and women. So, but
Yeah.
men are supposed to take folic acid too.
Yes,
That's what I'm just learning.
not just
Wow.
women, because the quality of their sperm matters. If you as a woman is doing all the work and your husband is giving you nonsense sperm, you still not achieve results. So it's teamwork. That's what men don't realize. Teamwork.
All right. Thank you so much, Doc. Thank you so much. This has been enlightening for me as a person, and I'm sure for many of our audience on this live. So we have a live question. I'll just take that quickly before any other.
Mhm.
Now, this is from a lady. She's asking, Doctor, please, I'm trying to get pregnant, but haven't seen my period for 2 months plus. I went to do a PT, that's a pregnancy test. I did a scan, and the scan showed polycystic eggs. Now, the gynecologist placed the lady on hormonal drugs, Primolut N, that's the drug in particular, to induce the menstruation. It's almost 2 weeks. I haven't still seen it yet, and there is no history of use of contraceptives. So, what do you think might be wrong in this case?
No, we know what's wrong with PCOS. But what she wants to know is what to do to get pregnant, because so PCOS is also known as polycystic
Okay.
ovary syndrome, right? So it's a disorder that some women experience, and it's becoming more common these days, right? So women that have PCOS, they have irregular menstrual cycles. And I talked about irregular menstrual cycles. When you have an irregular menstrual cycles, you're either not ovulating or you're not ovulating regularly, right? And for them, it can be difficult to track their ovulation. So if you're not ovulating, it will be difficult to get pregnant because we need that egg to be able to get pregnant, right? And it's not every woman that has PCOS that has problems getting pregnant. In fact, there are some women with PCOS, they don't know they have it and they've been getting pregnant normally. So if you are listening to that person that has, the fact that you have PCOS does not mean you can't get pregnant. So what your doctor did by giving you those drugs, right, is to regulate your menstrual cycle. So normally with people with PCOS, when they want treat for fertility, we first of all try to get them to have a regular menstrual cycle so they can ovulate regularly, and then they try naturally first, right? And if for whatever reason trying to get pregnant naturally is not working, there's also other options. There's assisted reproduction, right? They can decide to induce ovulation, see if that helps. If that doesn't work, they can do intrauterine insemination, right? If they are able to kickstart and make the ovaries to produce eggs, right? That's induced ovulation. And there's also the option of IVF, right? Although most people don't like that option because it's expensive, right? And not everyone has access to finances. But even naturally for PCOS, one of the major problems people with PCOS face is obesity. So they start to gain weight, unexplained weight gain. And this is because that PCOS, right? The changes in hormones. So what happens with PCOS is your body is producing excess of male hormones called androgens, right? And this suppresses female hormones. So you have excess of male hormones and you have little of female hormones. And those female hormones are the ones that are supposed to make you have a regular menstrual cycle. They are the ones that are supposed to make you ovulate. So when you don't have enough of that, you are now having the reverse. You're not having a regular menstrual cycle. You may not be ovulating. Then you might start to notice that you're having deep voice, right? You're noticing facial hair. You're having a lot of acne. These are some of the symptoms of PCOS, right? So and like I said, obesity is one of it. You start to gain weight that you cannot explain. So ironically, PCOS causes you to gain weight. But if you want to reverse PCOS, you have to lose weight because that weight gain also causes insulin resistance, right? So some of people with PCOS, we might be treating them with something called metformin, right? That helps to make the
Okay.
body more sensitive to insulin. So one
Okay.
thing that that person can do for herself is if she notices that her BMI, that's a body mass index. So when you compare your weight
Mm,
to your height, if it is
mm,
not within the normal range, right? And there
mm,
are online calculators that can help with this in case you're wondering how to calculate it, because that's a whole new life to discuss BMI. But if it's not within the normal range, that means she's either overweight or heading towards obesity. She needs to lose weight. A
mm.
lot of men have seen drastic improvements just after losing a few kilograms of weight. So one thing she can do for herself is to lose weight. And when she loses weight, her body will respond better to the drugs. One, she might not even need drugs to regulate her cycle back. But if she does need drugs, her
Okay.
body will respond better to that drug to regulate her cycle. And then she will
Okay.
start ovulating regularly and then she can try normally. So PCOS is not a I don't want to call it
Sometimes.
a sentence. Yeah, I was looking for a better word, but I couldn't come up with a better one. It's not a sentence. If you have
Yeah.
PCOS, you can still give birth naturally, provided you do the right things to reverse your symptoms. And if you need help with medication, if you take the medication, you're taking it diligently, you can still give birth naturally. But even if natural methods of reproduction are not working for you, there's also the option of assisted reproduction, right? So there's
Okay.
always a way out. But the easiest is to start with reversing your symptoms by losing weight. So I don't know if that,
Okay.
yeah.
Okay. So something I'm learning from this is that the major issue with PCOS is the ovulation.
Yes. So, no, the major issue with PCOS is that the body is producing excess male hormones that is now
Okay.
causing lack of ovulation, irregular periods, and all this.
Okay.
Yeah, but to
Okay.
be able to reverse it, one way to do that is one, your doctor will give you drugs to try and regulate those hormones so you have a regular period. But the
Okay.
major
Okay.
that has worked for most women is lose weight.
Just wait.
Lose weight. It
Okay.
will really make a difference for you.
Okay. Okay. Thank you so much for that. Now, another random question, though, for someone who is just trying to get pregnant. How early into pregnancy can it be detected? How
Can pregnancy
early?
be detected?
Yes, can pregnancy be
So,
detected?
for most women, they detect that they are pregnant when they have missed their period. By then, the pregnancy is already about 4 weeks. But pregnancy can be detected as early as 2 weeks if you use there are these special pregnancy tests now that detect pregnancy very, very, very early, right? But I
Okay.
think most pregnancy test kits you see in the pharmacy, they start working at the time
Mm,
you give birth, which is 4 weeks into the pregnancy, right? So,
okay.
yeah, I would say as early
Okay.
as 2 weeks. But
Okay.
if you want more accurate testing with the ones in the pharmacy, then wait till you miss your
Mm,
period.
okay. Okay. Then another question. Is it possible for a woman to see her menses while she's pregnant?
No, 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 no. I've said this thing 1 million times. People keep coming for me online. You cannot see your period when you're pregnant. So let me explain. Period by
Okay.
definition, right, is the shedding of the lining of the uterus in the absence of pregnancy, which means in the presence of pregnancy, a period cannot happen. This is simple English language, dictionary definition. In the presence of pregnancy, a period cannot happen. So this is not to say that some women don't bleed during their pregnancy. Yes, you can bleed during your pregnancy, but what you're saying is not a period. So don't say I'm having my period and I'm pregnant. No, you're not. Whether I like to, you are not. What having is bleeding during pregnancy, and bleeding during pregnancy is not something you should be proud about. You should report it to your doctor immediately because your baby might be in danger, right? So there are different types of bleeding that happen during pregnancy, but no matter the shape, the type, the timing, the irregularity, it is not your period. Period. I hope I
Okay.
answered that question.
Yes, you did. I just wanted you to touch on that. And then
Mm.
another question is this. Now, how true is it that you can determine the sex of your baby? That's for women who are preparing for a baby and want a particular sex. So,
Mm.
to what extent can they determine the sex of their baby? Now, the sex and also for multiples, people that want more than one babies. To what extent can you determine, can you control that?
So I'll be honest with you, a lot of people have been saying, oh, if you want to have a boy, do this one. If you want to have a girl, wait until after your ovulation, wait until maybe all these things are just people came up with these things. Nothing has been scientifically proven. If it happened for you and you did, it was just a coincidence. Whether you like it or not, coincidence, right? So the truth is, naturally speaking, you can't control those things. You can't. But through assisted reproduction and IVF, you can. If you desire to have a boy, maybe you've had a lot of girls and you want a boy, or you've had a lot of boys and you want a girl, you can do that through something called pre-implantation genetic testing that is done during the process of IVF. So they purposely select embryos that have the XY if you want a boy, or embryos that have the XX chromosome if you want a girl, and implant only those embryos. So that way you're having what you want.
Yeah.
That is the only way that has been proven to
Okay.
work. All the other natural ways is just trial and error. You can't control it, right? So if
Okay.
you're really serious about that, then you might have to
Okay.
go through the route, but it's expensive. It's not cheap. Just like IVF, it's expensive. It costs some
Okay.
money, right? And in terms of having multiples,
Okay. How about multiple?
you can't control that as well, right? Normally, people that have twins in their family, they have a higher chance because of genetics of having twins. But you know what? A lot of the twins I know, they don't even have twins. Maybe it's now their children that have twins, right? They themselves they don't
Yeah.
have twins. I also come from a family of twins, no twins. My sister is married to a twin, no twins. Her twins brother-in-law, no twin. In fact, her twin brother-in-law is married to a twin. So husband and wife are twins, no twins. So you have a higher chance when you are a twin
Twins.
of having twins, but it's not guaranteed. So really, no one can control these things, right? But again, via IVF, there's a higher chance of you having twins because when they are implanting embryos, they implant multiple. So if multiple get implanted, then you will have twins. That's why you see that a lot of people that have do IVF, they tend to have twins compared to natural like
Okay.
conception because they implant multiple embryos. So your chances are high, but even with IVF, is not guaranteed. You see people that had IVF and they had only one child. It does not mean they only implanted one embryo,
Yeah.
but only one got implanted, right? So no one can
Okay.
really control these things. So maybe just pray and
Okay.
fast. God answers prayers. He gives you what you want. So if that's
God,
what you want,
God does.
for me, yeah, because like me, I had a boy, I had a girl, and I knew I don't want to have more than two kids. So the second one I prayed, that I already have a girl. Please, I really want a boy. And I
The
got to
boy.
pray, you get what you want.
Yeah, that's true. Thank you so much for that.
Mhm,
Now, doctor, please, you mentioned heat with a
mhm,
man's sperm, right? I was
mhm,
going to ask, how about women? Does
mhm.
heat not also affect their chances of getting pregnant? That's internal body temperature.
No. So remember that the heat for men, right, affects production of sperm
Mm.
because they produce sperm throughout their lives. But our egg is already there right from the moment you're born. All your eggs that you ever have in your life, they're already there. So it's just that while you're growing up, the eggs are maturing. Every cycle, the eggs are maturing and they are being released when they mature. But they are already there, right? So heat doesn't really affect because even as women during ovulation is when your temperature even goes up a little bit more, right? So if anything,
Mhm.
go by that heat actually helps, but I did not say that too. So I hope that answers your question.
Okay, thank you. Thank you so much. Now, please, for our audience that are following us, if you have a question, just type it in the comment section and to be displayed for us to ask the doctor so she can answer you here and then, here and now on this live. And so I have one more question. before we take questions from the audience. Now, it's about the common causes of infertility for women, right? You mentioned endometriosis and fibroid. So, this is just a personal observation.
Mhm.
I've observed that it tends to be on the increase, especially endometriosis. So, my question is why? Is it a lifestyle effect?
Mm.
How is it that more women are coming up with these things? Like, we didn't know what it was some generations ago, and now
Answered it. You just answered
seemingly.
the question. I don't think it's increasing. I think there's more awareness, so there's more diagnosis. That's why it's looking like it's more. Women have always had these things, but there was no awareness. Some will go to the hospital and there's no diagnosis because people don't know. Even with PCOS, you see these days almost everybody you meet has PCOS. It's not because PCOS is a new disease or something in town. No, it's because
Mm,
there's now more awareness, so there's now increased number of diagnoses. So it's looking like it's more. It's not more, right? But then again, some of these our lifestyle habits could also contribute to some of the patterns we are seeing these days, hormonal imbalance and all that. You hear that, oh, even the hair relaxers we use can affect your hormones. Some of the food we eat can affect your hormones these days, especially people that live abroad. All these genetically modified vegetables and fruits we are eating, they can also affect your hormones. So yes, lifestyle plays a, as much as it's being diagnosed more because of awareness, but lifestyle also plays a role into these changes that a lot of people are seeing in their bodies that maybe our parents or grandparents didn't see. Right. So it's mainly because of awareness, but then there's also that little bit of, like you said, lifestyle and diet factors that also
okay.
can.
How about genetics?
How what?
A factor. How about genetics? Is it a
Oh,
factor?
so for different conditions, genetics could contribute to it, but genetics is only a
Yeah.
very, very small like everybody's gene is not suddenly mutating. No, no. This increase is not as a result of genetics. Genetics is something that is already there, passed down from generation to
Yeah.
generation, right? But you see this
Yeah.
new boom that you are noticing, and a lot of us are also noticing. It's more of um awareness, increased diagnosis,
Okay.
and a bit of those diet and lifestyle factors, right? But yeah,
Okay.
there are some things that genetics could affect, right? And in
Okay.
that's why we normally do genetic testing even before pregnancy and all that. So you already know the genetic conditions or disease that run in your family, and you do
Okay.
something to mitigate it where possible, right? Or if you can't mitigate it, then you are aware so that you know how to manage it if it comes up in your children, right? So
Okay.
with genetics, you can't control it. You just have to manage it or prevent it where possible.
Okay, okay. Thank you very much, Doc. Now, while we wait for any questions in the comment section, I would love everyone that's following us on this live to know that Dr. O is available for private consultations. If you have questions, if you have some things you want to check by her, I'm sure you must have learned a lot because like I can tell you all the things I took away from this. I remember all the illustrations on men, age, your sperm, how it's getting weaker, it's not swimming well and all of that. So she has simplified a whole lot, right? And if you would love to get a second diagnosis, you probably don't want to ask your question on this live, you can reach out to her. She's available for private consultations. She's also available on all social media handles with the handle name check with on Instagram. You can follow her and you can also read her. All the readers in the house. Dr. O is a knack on simplifying medical concepts with novels. So I have checked her store, actually. I didn't mention that, but I've checked your Instagram store and I've seen a lot, a lot of novels that will just simplify these simple things with intriguing stories that make it stick, right? You won't forget, and you also enjoy yourself by reading those novels. So please check it out on her Instagram store. That's at Check with Dr. O. Her Instagram handle, you can get the store there. You see a couple of them. And also there is a what's it called? A Telegram group for
Mhm.
women that are in this season trying to get pregnant and just learning from other women as well. And you also have direct access to her on that Telegram group. So please you can check her out on Telegram.
Telegram
Still
group
with
is
the hand.
moving to WhatsApp though. Sorry to cut you short. We are
Okay,
so we did a poll and we found that most of the moms there are more active on WhatsApp. So we are moving it to
okay.
WhatsApp by the end of the month. But you can join then you get the link to join the WhatsApp.
All right. Still with the handle check with Dr. O, right?
Yeah. No,
That's
Telegram
Telegram.
group. No, it's called the Moms Club. The Moms Club. Check with Dr. O is a
Okay.
separate, I have a separate Telegram group that is for everybody. That one is check with Dr. O. But the Moms Club is
o-
just for moms. So if you search the
Okay.
Moms Club, you find it.
All right. So, guys, you've heard that. You can check her out on the Moms Club. It will soon be on WhatsApp, right? But you can also follow her on all her social media handles on YouTube as well. I don't know if I mentioned that. She's on YouTube, and with all of these videos, please, you need to go and check it out. Like everything she explained, you'll see illustrations. I can't forget, like, I remember checking your channel and I was just learning a lot. Like, so many things were taught, right? There's a theory of it, but for the first time, personally, I would mention that I got to understand this thing of how that a woman is born with a certain number of eggs because of the illustration you gave. Like the thing just stuck to my head. So you can check her out. You understand everything you want to know about fertility, about reproductive health for women, because she has a lot of illustrations to explain this concept to you, right? So now, finally, I haven't gotten any other question from the audience. Okay, Flourish Hair Institute from Kirby. I see you. Thanks for joining us. Thanks for joining us. So I haven't gotten any other question from the audience. We have Domski Capable from Benin. Thanks for joining us. I see you. Akpan David from Abuja. Thanks for joining us. Thanks for joining us. Esther Joluba from Lagos. Thank you so much. We are happy to have you. Okay, I've seen Canvas Legacy Artistry from Lagos. Thanks for joining us. So, but I haven't gotten any other questions from the audience. So, before we wrap up, Doc, please, do you have any final words for us on this subject of fertility and yes, for both men and women? Mr. Aubrey, thank you. I see you. So, over to Dr. O, please. Final words.
Yeah, so for final words, I'll just say every couple should keep in mind that fertility is teamwork because we find that we have to drag the men for fertility testing to the hospital. Like I said, it's both of you that are involved. So it is teamwork, right? And number two,
Okay.
don't put pressure on yourself. Every couple, every woman deserves motherhood, deserves parenthood, and everyone who desires it will get it. It's only a matter of time. So don't put pressure. Just be patient, enjoy the phase, enjoy the wait, and it will happen at the right time.
Okay, thank you so much. You heard that right. Fertility is teamwork. Fertility is teamwork. So please, men, don't put pressure on your wife. Follow her to the hospital instead. Support yourselves in the journey and also be open. Be open. I'd say that because she said a lot of things. I remember you said PCOS is reversible. Just putting it out there. PCOS is reversible, right? And then even if you decide that okay, you're tired of waiting or something, there are also assisted reproductive methods through which you can also have your baby. So it's almost like saying there is not a single route. There is not only one way to have a child. Maybe that should be the conclusion on this matter. Yes, do your checks and balances, do your best and all, but if you decide that you want to have a child another way, you can try it out. You can try it out. There's even the option of adopting. I don't know the stigma around that, but personally, anyway, I'm not going to say anything on that right now. But please, let's be open. There are so many options. I've seen persons that, I'll just put this out there. I've seen persons that it was not until they started taking care of some other person's children that were not their children that they were able to conceive and have their own children naturally. So, just like Doc has said, you don't need to put pressure on yourself. You don't need to stop, put your life on hold. There's a whole lot you can still do in the time. And if, yes, you are so interested, you can really take care of other people's kids. If you don't want to adopt them directly, you can just decide to cater for them in your own little way, right? There is always a way to enjoy that blessing of having children. And it's not only one way. But yes, every mom desires or deserves, every woman deserves to be a mom. So this is not to stop you from trying, right? So thank you so much. I didn't get any other question from the audience. So I think we'll leave Dr. O to retire for the night. Thank you so much, Doc.
Thank
Thank
you
you
for
so
having
much.
me. It's been a pleasure joining you today.
Thank you, Ma. So see you.
Yeah, bye.
Yeah. Thank you so much. Now, for everyone that joined us on this live, I want to appreciate you big time, big time. Thank you so much. Thanks for making it possible. So don't forget, you can follow Dr. O on all her social media handles. Just check her out with the tag check with Dr. O. She simplifies every single thing. Oh, we have a question that just came in late. So I guess we're going to have to forward this to Dr. O directly. Please, if you can follow her and ask her directly, it will be well appreciated. But let me just read it out. How can one prevent fibroid? How can one prevent fibroid? That's coming from Favor from Berlin. Thanks for joining us. Our dog just stepped out of the room. But let me just put it out there. How can one prevent fibroid? Okay, Favor is also saying adopting is perfectly fine. I also don't understand the stigma. Well, it's probably a cultural thing. I don't know, but it's always a good thing to be a blessing in the meantime. So, like we said, you can also just take care of other people's children, even if you don't want to adopt them directly, right? So, but then to your question, how can one avoid fibroid? Doctor mentioned just your lifestyle changes and pay attention to the things you're doing and basically your lifestyle changes and the rest. But I am not the expert on this conversation. So I'll just say, please, if you can reach out to her directly on any on her social media handles, I'm sure she'll be more than delighted to answer your question because she's out of the life already. So that's we that's that on that. You can check her on Instagram, check with Dr. O, the same thing on Facebook, the same thing on YouTube, the same thing on Twitter. And then for yes, also on Telegram, there's Check with Dr. O, and there's also the Moms Club. So you can check with her and then you can ask your questions directly from her. I am very sure she'll be more than delighted to have you, to answer you rather. So I think that'll be all from me tonight. Our time is up. Thank you so much. It was an awesome time with you guys. Now, don't forget, we'll be having the next interview next week, Saturday, same time, 8 p.m. West African time. We'll notify you on the doctor that will be coming on board with us for that conversation. And for every pregnant woman, for every nursing mom, and for the woman who is believing to be pregnant, right? Please keep following, please keep watching, and also send in your questions. That's why we have the doctors here to answer your questions. Now, to the next time, I remain your host, Dr. Sophia Igbineweka.